an application that is being developed. It's not ready for public use yet, but it's extremely exciting, and it's somewhat groundbreaking that we could actually have apps on our phone that would help identify signs and symptoms of a stroke. And that would be incredibly important for people to have access to, so that they could have themselves assessed, confirm what they think or their family notices, and direct them to get help immediately. Because as you know, or as we all know, stroke is a very time-sensitive disease, and the faster you seek treatment, the faster you can be evaluated and receive sometimes life-altering, life-saving treatments. So yeah, this app is being developed to detect some of the major symptoms of stroke, facial weakness being one of them. That means when maybe there's a facial droop or one side of the face is droopy. And in testing, that was detected with a very high degree of accuracy. It's also being designed to test slurring of speech. So taking people's normal speech patterns and then detecting when they maybe have some weakness in the muscles in the throat and the face that make them slur their speech, and also looking at arm weakness. So those are major signs of stroke. Of course, they're not all the signs of a stroke, but they're ones that are being developed on this app to detect signs and symptoms of a stroke, and will help patients potentially diagnose what's going on with themselves and help them seek very timely treatment. Yeah, I think this is really exciting technology, but with all new technology, we have to be certain that it gets to the right people, right? So there are underserved or underrepresented populations who don't have access to the technology, or perhaps are unfamiliar with it. And I can think of rural residents who live in very, very remote areas, making sure that they have Wi-Fi and signal capabilities to use this app. And when they live far away from a medical center, getting very timely information that they may be having a stroke would be vitally important. And we have to make sure that they have access to technology. And I also think of elderly patients who might not be as adept at using technology. We have to use technology wisely. We have to make sure that all the people who it's meant to help have access to it. So I think that's one major concern or consideration that we should have as these things roll out. Right. And the importance of recognizing early signs of stroke is because stroke is a very time-sensitive disease. For many patients, unfortunately, they arrive at a medical center or they arrive for evaluation too late to receive some of the very time-sensitive medications or treatments that we can provide. Again, we have a very limited time window, usually 3 hours or maybe up to 4.5 hours for some of the clot-busting medications in layman's terms. And we have a little bit longer window for interventional treatments, but still far too many patients arrive for evaluation too late for them to qualify for these treatments, which again can be very beneficial. It's been shown time and time again that people who get these treatments early are far more likely to be living independently and able to care for themselves and enjoy a great quality of life than people who don't get these treatments early on.